We are being guided by the science.
We'll be guided by the science at all times.
We followed the science throughout this, building on that science.
We will be relying, as ever, on the science to inform us as we have from the beginning.
Follow the science, they say, as if the science is a certainty. But the science isn't always straightforward and can be complex. Who you choose to listen to or how you interpret it can take you in different, deeply political directions. And science, like life, is shaped by its backstory. And for British epidemiology, it starts here, about 150 years ago. This water pump in London's Soho tells the story of one of its major moments. Dr. John Snow identified it as a source of cholera, a bacterium that was killing hundreds of people around London. He knocked on door after door to see who had been infected to collect detailed data about the outbreak. It mightn't sound like much, but it was a big British contribution to global public health. Fast forward to 2020, and it's off the back of the science that politicians are making important decisions, the rights and wrongs of which are being scrutinised now and will continue to be in the future. But what we can ask is whether the science informing those decisions is the most appropriate and complete. I was an editor on a medical journal for many years, and my first big investigation was trying to make sense of something that happened in the UK around 10 years ago.
The viral invader. H1N1 swine flu is spreading faster than many thought possible.
On that occasion, the models put together to try to predict how the outbreak would unfold had said up to 65,000 people could die of swine flu. But in the event, there were 500 deaths. So with COVID-19, as so much was being invested in the work of some of the same people at Imperial College London, it made me wonder how they'd worked out that up to 500,000 people in the UK could die. This was Boris Johnson speaking last week, 5 weeks into lockdown.
It's thanks to that massive collective effort to shield the NHS that we avoided an uncontrollable and catastrophic epidemic, where the reasonable worst-case scenario was 500,000 deaths.
Sadly, there have been more than 30,000 deaths during this outbreak, far higher than 10 years ago. The Prime Minister has claimed that lockdown has prevented a much worse situation. This 500,000 figure is what the modellers predicted would happen if the epidemic were allowed to go unchecked, if we did not put measures in place to try to slow it down. This is the graph from the Imperial team, published on the 16th of March. It spans the period from March to October and shows deaths peaking in late May. But should the Prime Minister have ever been talking about this figure of 500,000 deaths? After the swine flu outbreak in 2009, the UK government's commissioned an independent report into how we responded. It was authored by Dame Deirdre Hine, former Chief Medical Officer of Wales. She said the term worst-case scenario used by Boris Johnson is unhelpful, given that it implies a reasonably likely event rather than one that is extremely unlikely. Dame Deirdre's report also warned that ministers should not rely too much on models in the early stages of a pandemic when they are unreliable because of insufficient data.
The tendency is for politicians and the general public to be a bit dazzled by the opportunities that modelling affords. I learnt that modelling was a very powerful tool, but only if it had testing and contact tracing as its precursor and as its contributing into it. I think the tendency is that modelling overstates the possibilities of deaths in the early stages because they don't have that on-the-ground intelligence. Actual people going round identifying people who have the virus and tracing their contacts. That is really quite essential in order to put the modelling into the right context.
Dame Deirdre says Jon Snow's original approach is as relevant today as the models. His door knocking to find infected people, an early version of what we call contact tracing. His door knocking was also data collection, and a model without the data can't really tell us that much. But we stopped widespread testing and contact tracing in the middle of March, a move that many now see as a mistake. It's worth remembering the models were the basis of so many big decisions. The lockdown, schools closing, the NHS stopping doing swathes of its core services. Modelling can be extremely useful, but not in and of itself. It is completely dependent upon what you put into it, the data that underpin it. At the time the Imperial model was published, we were drawing on limited data, by and large coming out of China and Italy, both countries with different healthcare systems to the UK. But were scientists and politicians clear in how uncertain the data were?
So I think when you give single figures, and particularly when it's like 510,000 when it was first released, then that gives this notion of precision. It makes it sound like it's a correct answer. I think it's actually beholden on people who are using results from such estimates. Politicians who are using those results should also emphasise the uncertainty.
But we've heard other numbers bandied about too. The Imperial model contained other predictions. It forecast that 250,000 people could die in the UK if we had simply kept with the less restrictive measures like social distancing, hand washing and banning large gatherings. We then heard this from the government if we locked down.
If we can keep deaths below 20,000, we will have done very well in this epidemic.
We're now well past 20,000 deaths. Professor Carl Hennigan thinks the models might have been a blunt tool and distracted from our understanding.
One of the key problems with models is they're generally derived on a very small piece of information and then extrapolated it to some point in the future. And if you did it differently, instead of deriving with a bit of information, you updated them regularly as new information emerged, you would start to see an incredibly different picture about what they predict. We would have seen the emerging problem in nursing home, in the elderly, and redirected where we go to.
It was the model, perhaps aided by scenes of overwhelmed hospitals in Italy, that ushered in the lockdown, and there are many who think we locked down too late. But there are also those, including some who advise the government, who question whether we really fully considered the impact of locking down rather than being less severe in our approach, like Sweden has been.
I think if the government had been perhaps more on the front foot at the beginning, that might have been a sustainable strategy. As it was, I think they got rather blown off course by the pressure from social media, from mainstream media as well, with the question about why are we not doing what everybody else is doing. And I think there were genuine questions about the strategies that were adopted by some of our European neighbours, which never really got properly debated because of the overwhelming noise from the social media channels.
There are some who point to the unintended effects of our policy. Anecdotally, we've already heard about people, including children, dying as they're too scared to go to hospital. A predicted 20,000 extra deaths from cancer and a big drop in A&E attendance. The latest ONS data suggests that 30% of excess deaths, so those over and above what you would normally expect to occur, did not have COVID on the death certificate.
So the influential model in the UK policy, in the paper they explicitly say, we're not looking at other aspects of the intervention. I think it should be considered as lives versus lives, because all aspects of people's lives are being influenced and seriously influenced by the intervention. So there was no evident weighing up of that. I don't know of any discussions where that was publicly made clear, where that actual weighing up was actually presented to people. I think that's a massive oversight.
That is not to say it was necessarily the job of the Imperial model to assess the wider impact of different measures. Perhaps these considerations have been explored but not shared with the public. We're following the science, yet an important part of the equation appears to be missing.
Clearly, there is a point at which the number of deaths being caused by the virus will be exceeded by the number of deaths that are being caused by the lockdown. Going further forward, we can also consider the number of deaths that will result from the disruption to the economy and the impact of future levels of unemployment and social disruption that will occur over the next few years. And that death toll may very well exceed the death toll from the infection itself.
We don't ultimately know how many people will die of all illnesses as a result of our response to tackling the COVID outbreak. All deaths are equally important, but when we talk about following the science, it's clear that much is uncertain, and there's more than one way of looking at it.
That report by Deb Cohen. Imperial told us Imperial's models and projections are updated and published on a daily basis as new information emerges, and we continue to communicate estimated levels of uncertainty around them. They added, our epidemiologists were and are very clear about where their expertise sits and where other experts or wider society and government would be better placed to grapple with ethical or economic questions. A government spokesman told us, from the very beginning of this crisis, we have listened to the advice of our world-leading scientists and medical experts and taken the right measures at the right time to defeat coronavirus. Deb's here with me now with a bit more analysis of the government's handling of the COVID-19 outbreak. Deb.
Yes, Emma, you heard from Deirdre Hine in the film, and we're obviously talking to her about the issues raised about the science. And afterwards we said to her, well, is there anything else you'd like to say? And she said there was. And what she said isn't exactly complimentary about the government's handling of the outbreak.
One of the most important things in my report was not any of the recommendations. It was a paragraph in the letter, the covering letter to ministers, saying, in effect, we've got away with it this time, but don't be under the illusion that there will not be a more severe pandemic in the future, and that you really need to be thinking about the resources needed to combat such a pandemic. I think that maybe they heard that message at the time, but other things came and they took their eye off the ball somewhat. And certainly the resources, as we've seen, the resources were not there in the first instance to combat it effectively.